What are the fasting requirements for an accurate cholesterol test? Imagine sitting in a doctor's office, wondering if your cholesterol levels are in a healthy range. You might have heard you need to fast before your blood test. But is that always true? Let's find out what really matters when measuring cholesterol. In the past, fasting was a must for cholesterol tests. Doctors asked patients to avoid eating for 8 to 12 hours before the blood draw. The reason was to prevent recent meals from affecting the results, especially triglycerides and low-density lipoprotein cholesterol, often called bad cholesterol. Eating can cause temporary increases in triglycerides, which might make the results look worse than they really are. However, recent research shows that for most people, fasting is no longer necessary. Studies indicate that total cholesterol, high-density lipoprotein cholesterol, and low-density lipoprotein cholesterol levels are minimally affected by eating. The differences between fasting and non-fasting tests are usually very small, often just a few milligrams per deciliter. These small differences typically do not change how doctors decide on treatment. Current guidelines reflected this new understanding. Many healthcare providers now accept non-fasting lipid panels for routine screening and monitoring. This change makes testing more convenient for patients, as they can schedule blood work at any time of day without fasting. But fasting still matters in some situations. If you have high triglycerides or conditions like diabetes or prediabetes, fasting can give a more accurate picture of your triglyceride levels. Elevated triglycerides can be more affected by recent food intake, so fasting helps ensure the measurement is precise. If your previous tests showed high triglycerides, your doctor might recommend fasting before your next blood test. Also, certain clinical situations or medication adjustments may require fasting samples. Most people find it easiest to schedule their cholesterol test in the morning after an overnight fast. But remember, you can usually drink water during fasting, which helps stay hydrated. Always follow your healthcare provider's instructions, as they may have specific guidelines based on your health history. In summary, fasting for 8 to 12 hours is generally recommended only when triglyceride measurement needs to be very accurate or if you have a history of high triglycerides. For routine cholesterol checks, non-fasting tests are reliable and more convenient. This approach helps keep testing simple without sacrificing accuracy.